Each year, more than 3 million Americans are diagnosed with peripheral artery disease. Symptoms include leg pain, especially when walking. And this morning, our daytime cardiologist, Dr. Shoba, is here to discuss PAD and what we can do to reduce our chances of developing it. Good morning.
Good morning.
You know, I think a lot of people, like I mentioned there, it's just leg pain for a lot of people.
Right, exactly. And so it could be something very serious, like a circulation problem in your legs.
Right.
And people check it off to, oh, it's arthritis, oh, it's the end of the day. And the simple symptoms that a person can present with, they have achy pain in the calf when they walk and they get better when they rest.
Right.
Sometimes they have even hip pain all the way down to the leg and they think, oh, it's a pinched nerve, oh, it's my arthritis. But guess what? It could be a more serious problem
Right.
like peripheral artery disease. And so when we talk about circulation in the legs, we are looking at artery circulation that takes blood to your toes.
Right.
And venous circulation that takes blood from your toes back to your heart. You know, the veins are associated with blood clots in the veins, with varicose veins, so that's a different topic. But this is arteries, just like you have arteries taking fresh oxygenated blood to all your body parts. If they have a narrowing, if they have cholesterol and gunk built up in them, you have poor circulation in your legs. And you may notice a difference in the color between your legs. One foot is pale. When you raise it up, it's pale. If you know how to check the pulses in your leg, you may not be able to feel the pulses in your leg. The skin sometimes becomes shiny and you have less hair on one leg than on the other. These can all be signs of circulation problem in your artery. The worst part is if you are beginning to develop an ulcer or you have an injury to your toe and it doesn't heal appropriately and it's recurring and lasting longer, that could be because of a circulation problem in the leg. And taking care of it early on can prevent serious catastrophes down the road.
I sometimes think, our feet, our legs, I think some people equate getting older with just being a part of life, developing aches and pains. But you got to pay attention to those aches and pains.
Oh, that's right. I mean, you're going shopping with your parent and, they say, oh, I have to sit down. My legs are just killing me. Think about peripheral artery disease. And another reason why it is important is because cholesterol, when it deposits in the leg arteries, is also silently depositing in the heart arteries and in the arteries of your neck. So those patients are at high risk of developing heart attacks and strokes. And there are very, very simple tests that you can do. We generally check for smoking history. Smokers have a worse outcome. People who have high blood pressure, high cholesterol, and diabetics, oh my, they have small arteries to start with, and on top of it they can have PAD. It's a simple check actually. If you don't feel pulses, we actually do a test called ABI. They check the pressure in your leg and they check the pressure in your arm, and if there is a difference, that tells you that you have PAD. A very simple test can tell you if you have that condition.
And we have just a few seconds left here, and it's an important question to know, what can we do if we are diagnosed with PAD?
I think getting appropriate care and taking care of all the risk factors and getting appropriate treatment, because there are lots of treatments available for that.
All right, Dr. Shoba, thank you. Great information as always. Folks, it's about PAD, peripheral artery disease. If you want to find out more, go to heart.org.